Hello, and today's 100 metre dash is about bone stress injuries in runners and how to prevent these with optimal workload. This is also the title of a journal I recently reviewed, and also a podcast that I was listening to with Brad Beer on the Physical Performance Show. He had Stuart Warden on, and listening to the podcast was absolutely fantastic for my clinical practice, but also gave me a better insight into how to manage bone injuries. And I wanted to share some of that information with you guys today. I'm not walking today because there's quite a lot of information. Bone stress injuries are frustrating, sore, and tend to disrupt your training. The occurrence is sometimes not well known. It can be in the lead up to events that have been earmarked as being quite important, or your goal race, or big events, or after a long, prolonged process of loading. In a normal process in the body, micro damage or small cracks form in the bone, and this is quite normal in the healthy population. These small cracks trigger bone reabsorbent osteoclasts, and that's kind of like the removal process of the broken bone. The process is then followed up by osteoblasts, which they actually create new bone to fill the void made from the bone that was taken away. Generally, this happens on a day-to-day basis, weekly, monthly, and ongoing all throughout the year. Bone injuries tend to occur when the normal process has a load error, or there's a disruption in that normal process itself. For example, with training, the bone microtrauma is more than the body can repair at that time. Interestingly, it takes about 4 weeks for the response to remove microdamaged bone, and then 3 to 12 months to replenish and replace that bone. The bone type can vary this time, so depending on which type of bone it is, it can take a little bit less time or a little bit longer, and that's why certain bones tend to have stress injuries rather than others. At some point, there's a crossover period between when the bone will be more porous or before the remodeling phase happens. So if it starts breaking down after 4 weeks and starts replenishing after 3 months, there's that void that needs to be filled. With this in mind, an increase in volume of training, in particular speed, increases the micro damage that occurs within the bone itself, and the response to loading come in 3 to 4 weeks after you've had that big session. Micro damage is threshold driven, and this depends on the amount of times a bone is loaded and the level at which the bones are loaded, i.e. how many times they're loaded. There's a strong link between the level of bone loading and how often the load is applied to a certain part. It is being suggested that a 10% increase in tissue strain in running halves the number of loading cycles before bone fatigue. So by even just increasing your training slightly, there's less time before the bone fatigues. The stronger the bone's obviously better, it absorbs the load better, and the weaker the bone, the less it absorbs the same load. So bone health is so important for absorbing these loads. So the goal from a physiotherapy point of view is to improve the skeleton to resist load and adapt appropriately and manage the loads that are applied to it, but also reduce the damage accumulation. It's quite confusing because both loading the bone protects and causes the bone injuries that I'm speaking of today. In the paper by Warden et al., I directly quote him, said that the interaction between the number and magnitude of bone loading cycles that induces adaptation to best enhance function and also reduce the injury risk is the job of the physiotherapist. So what is the optimal for bone loading? I guess it's very person specific, taking into account their running experience, their previous injury history, their past medical history, and to a certain degree their gender. The skeleton can adapt to mechanical loads to improve its strength, but all these factors do have an input on that. So how do we reduce the risk? Running itself isn't enough. We need to have weight bearing exercises, including explosive jumping, sprinting, with and without change of direction, and these have the best bone strength and potential. Distance runners have some of the highest bone related injuries due to stress in the bones, which may in part be due to poor bone health. The sport of running isn't as good at bone strength and activity as, say, gymnastics, aerobics, where there's multi-directional input. I found this quite interesting and practice changing, and I wanted to investigate further why this occurs. During being stressed or loaded, the bone cells that respond to this stress become desensitized or deaf. The literature suggests that after 20 back-to-back cycles, there's a reduction of 95% activity with the bone. Therefore, it reduces adaptation and becomes less resistant to stressing and loading. The bone basically gets bored with the same loading time after time after time, so it stops responding to that load. A rest occurs. Allowing the rest to occur allows the receptors to switch back on and start to listen or engage in loading. Normally, 4 to 8 hour rest periods are cited as being most relevant. Adding in a secondary plyometric set, only a few minutes worth, later on after your run, say 4 to 6 hours, may generate further bone adaptation and better absorption of load. The bones need a different stimulus throughout a prolonged training block. The level at which there is an adaptive response increases, so it requires more stimulation to reach it. So normal progression overload doesn't really fill this gap as it's too small an increase. In a study where they looked at animals, they looked at 5 weeks of stress on the bone, 5 weeks off, and then 5 further weeks of stress on the bone, and that was more superior in changes to bone strength when compared to the same animal that did 15 straight weeks of progressive overload. And this was superior even though there was a third less loading involved. Furthermore, early sport specialisation, i.e. doing one sport only prior to puberty, has an effect on bone stress injury risk, especially when that one sport is running, swimming or cycling. That increases your bone stress injury risk. Bone loading, when applied in the clinical setting and in real life, should be multiple directional. The training should be multiple directional. The rehab should be multiple directional. Changing direction and jumping and landing should be encouraged as it keeps that skeleton system awake and engaged. This is shown to be more robust and lower bone stress injury risks in all sports than just one direction on its own. It is true that before pre-puberty you can change the bone loading, where with mature athletes the focus should be more on managing load as opposed to trying to gain bone strength. The basis that comes down to is that all bone stress injuries are linked to training errors. It is, however, hard for a single rule of training overload progression to be applied to every single individual, but there is some certain things to take into account. A 10% rule or an acute chronic workload ratio may suit some but not all individuals. It does come down to the individual's biomechanics, psychology, physiology, musculoskeletal qualities and also their diet. And this plays a huge part, as does the energy available to perform their training or their task that they're looking to do. Keeping a good track on workload of training is so important with BSI, bone stress injuries. Overestimation and more prevalently underestimation can affect the bone stress injury. The training volume should be sought before intensity. Where in a clinical setting it is safer to increase the volume rather than the intensity, and therefore thinking about train slow, race fast. When intensities begin to be introduced, the volume should be reduced rather than linearly increased as well as the intensity. One method of reducing bone stress injuries can be increasing the cadence of a runner. The reduced stride length does increase the load in cycles, but with a reduction in the velocity of the centre of mass and its demand placed on the joints. The research suggests that a lower cadence in cross-country runners has 6.7 times more risk for bone stress injury at the shin than their counterparts of a higher step rate. So in summary, what did I learn from the podcast and from the journal? In mature skeleton, we should track workload to avoid acute workload spikes. We should also include rest periods in programs, 1 day per week minimal, and also 1 week completely off feet every 3 months when looking at bone health. When indicated, attempts to reduce bone loading, such as increasing cadence, may be considered. The injury round about the bone may occur 3 to 4 weeks after the training spike. So it has to be tracking your workload and workload volumes is very important. Thanks very much for listening, and if you've got any questions around about bone stress injuries or any questions around about running injuries, please get in contact with myself, James, at spearphysiotherapy.com.